Hey, good day, guys. Still on our respiratory physiology. Today we'll be discussing the compliance of the lungs and the chest. Okay. When they say lungs and chest compliance, what do they mean by this sentence? Okay. Now, I would say that compliance is the extent to which the lungs and the chest wall can expand or stretch. Okay, to accommodate air. All right. When you inhale air, the compliance is the range to which lungs and chest can actually expand and stretch. Now we say that it is expressed as a change in lungs volume per unit change in what transpulmonary pressure. Okay. Now, in a normal man, an increase in unit transpulmonary pressure will expand the lungs to accommodate over 200 milliliter of air. Okay. A unit change in transpulmonary pressure will expand the lungs to accommodate 200 milliliter of air. All right. Now, this is an image just showing expiration, inspiration. You could see how expiration, the chest wall contracts, while on inspiration, the chest wall increases. Okay. Now, first of all, let's talk about lung compliance. We say that the lungs contribute to the elasticity by possessing two elastic forces. Okay. Now, the first elastic force, we say that elastic forces of the lungs tissue, which is determined by elastin and collagen fibers interwoven between the lungs parenchyma. Okay. Now, stretching of these fibers will expand the lungs, all right, since they are elastic. Secondly, we say that elastic force is caused by surface tension. When air comes in contact with water on the alveoli, okay, and the water molecule on the surface generates what? A strong attraction for one another and attempt to contract, okay, and to force air out of the alveoli, okay. In doing so, they try to cause the alveoli to collapse, okay. Now, this is a surface tension effect, okay. Surface tension between water and air, all right. Now let's proceed. We say that in trying to collapse the alveoli, the entire lungs generate an elastic force to counter the surface tension. Okay. Now, surfactant. All right. We have spoken about the surface tension. Okay. Now we are trying to talk about another thing now. Now, a surfactant, an organophospholipid. It's produced by what? Type 2 alveoli epithelium cells. Now, this poses a detergent action that opposes the ability of the water molecules from attracting each other. Okay, by so doing, it prevents the alveoli and increase lungs compliance. Okay, so the surface tension can be countered by surfactant effect and can also be countered by what? The elastic force that the lungs will generate to counter the surface tension. Okay. Now, let's talk about maybe the clinical part of the surfactant. Now, surfactant synthesis starts in late fetal life. That's during 6 to 7 months of intrauterine life. Now, premature babies born before this period will suffer infant respiratory distress syndrome. Okay, and this could be life-threatening. Okay, infant respiratory distress syndrome could be life-threatening. Okay, this is just the compliance of the lungs and the chest wall. Now, having spoken about the lungs and the compliance of the lungs, where we say that the elastin fibers, the collagen fibers help the lungs to be compliant, okay, elastic. Let's talk about the chest wall compliance. Now, we say that the thoracic cage contribute to the lungs expansibility by the movement of various joints, okay, that help in increasing the thoracic cavity. When you inhale air, you see that the anterior posterior diameter of your chest wall is increased. Okay, that's the chest wall compliance. Now we say that also muscular components of the chest wall will also contribute. All right, muscles of inspiration will also contribute. Now we have the external intercostal and the accessory muscles of inspiration. okay? Accessory muscles of inspiration, I think the anterior serratus muscle, the sternocleidomastoid muscle, and so on and so forth, okay? So that, guys, we are done discussing about the lungs and the chest compliance, okay? So see you guys in our next tutorial, and bye for now. Do subscribe to our YouTube channel. Bye for now.